If you sell all on X and you want your treatment coordinator to close a lot more cases, they need to help patients reset emotionally before ever mentioning the investment. Here are 3 crucial questions to help make that happen. After you finish presenting treatment, your patient is sitting there with a flood of new information. So even if they're nodding, they're often overwhelmed, they're unsure if they understood everything, and they're very nervous about what comes next. So if your TC just jumps straight into investment, they're asking the patient to make a major decision at the peak of their anxiety, and that's when you're going to hear stuff like, I need to think about it. Instead, you need to coach your TC to ask one or more of these 3 crucial emotional reset questions before they ever talk numbers. Question number 1, this is the big one. That was a lot of information. How are you feeling about everything that Dr. Smith just shared? This works because it gives the patient space to process. It signals that you care about their comfort and not just the sale, and it surfaces concerns they might not volunteer otherwise. Question number 2, this is a clarifying question. What questions do you have about the treatment plan before we talk investment? Or does everything about the treatment plan make sense? This works because it positions you as a partner in their decision. It ensures they fully understand the clinical side before moving to the financial side, and it reduces fear of the unknown. A confused individual does not buy. Question number 3 is a confidence check. On a scale of 1 to 10, how confident are you that this plan will give you the results you're looking for? This works because it turns vague feelings into something actually measurable. If they say anything less than a 9 or a 10, you can immediately ask something like this. What would need to happen right now for this to be a 10 for you? Now you know exactly what's holding them back. So how you use this is you ask these questions right after the doctor leaves the room. You listen without interrupting and you acknowledge their answers before transitioning to price. Only move to investment once they're calm and they're clear. So coach your TCs to use these 3 questions as a bridge between your clinical presentation and the financial discussion. And it will be the difference between closing a lot more cases. Because if you try to close while the patient is anxious, they will not move forward. Full Arch Doctors TCs, like, follow, or subscribe for more tips on closing high-value full arch cases.